An assisted cough involves the use of a stomach thrust to help build pressure to produce a cough and expel mucus. In this demonstration video, you'll see how the breath stacking and assisted cough technique is done while seated in a chair with one person assisting. There are two ways to do the breath stacking and assisted cough technique. If you are able to squeeze the bag yourself, you can do the bagging while the person assisting positions themselves to do the stomach thrust. Or the person assisting you positions themselves to do the stomach thrust with one hand and squeezes the bag with their other hand. First, because the person doing the stomach thrust will be applying an inward and upward pressure to your torso, it's important to be sure your chair is placed against a wall and the wheels are locked, so the pushing pressure doesn't cause a tip. You may want to place a pillow behind your head if you don't have a headrest to avoid hitting the wall. Once your chair is secured and you and your assistant have decided who will squeeze the bag or be the bagger, your assistant will get in position, facing you, ready to thrust after the stacked breathing. The assistant will place the palm of their hand below your ribcage and above your belly button. Before starting, make sure to establish a signal with your assistant to tell them when your lungs are full. A head nod or a wave, whatever works for you. When ready, take a large breath in through the mouthpiece and hold that air. The bag is now squeezed 2 to 5 times, and you inhale with each squeeze to give you successive breaths of bagged air. The assistant can count and say, "Breathe in," on each squeeze. Once the lungs are full, and just before removing the mouthpiece from your mouth, the assistant then pushes up with some solid force, but not enough to injure you. Then make yourself cough as the mouthpiece is removed.
Breathe in, and cough!
Your assistant can try saying cough as a prompt. If the breath stacking and assisted cough is successful, a high flow of exhaled air will occur as the mouthpiece is removed. If mucus is loosened, you might hear a rattling sound or feel congested. Cough out as much mucus as you can and spit it out into a container or tissue. Repeat the whole process 3 to 5 times or until all the mucus is out. Rest in between cycles, and remember to clean the mouthpiece afterwards. After breath stacking and doing several assisted coughs, you should do 2 breath holds.
Breathe in again. And now just hold your breath, let it out.
The breath hold is
1,
done by giving you successive breaths using
3,
breath stacking,
4,
but instead of coughing at the
5,
end,
and a
you will
slow
hold your
release.
breath for as long as possible, from
That's
3
great.
to 5
Does that make
seconds,
it good? Or is
before
it-
exhaling.
That's good. Good. All right. So we end it like that, just so that you're not ending on that cough note, right?
If there's no one available to assist you, you may be able to assist yourself to build pressure to help you create a productive cough. To do this, after breath stacking, place your arms across your stomach. Then push in and up or lean forward as you cough. Or you can use a sturdy table or desk to help stabilize yourself to build enough pressure. First, with your legs and arms positioned underneath the desk or table, push your shoulders back into your backrest. Then, leaning over the desk or table, bend forward to help put pressure on your abdomen, cough, and then press your shoulders back again, lean forward again, and cough again. This will help create a productive cough.
So why would you want to do a stomach thrust to increase the force of a cough? A cough is your body's way of responding when something irritates your throat or airways. The irritant stimulates nerves, which then send a message to your brain. The brain then tells muscles in your chest and abdomen to push air out of your lungs to force out the irritant. However, a spinal cord injury at T12 and above affects the strength of your stomach and breathing muscles, and these muscles help you to take a big breath in, and you need the strength of these muscles to produce enough force for a good cough. And an assisted cough helps your stomach muscles produce this force.
Some things to keep in mind. Not everybody needs the combined breath stacking and assisted cough all the time. If you have a cold, that's when you would add an assisted cough. Consult with your healthcare team to come up with a plan for maintenance that makes sense for you.
So, when should you use the breath stacking and assisted cough techniques? To keep your lungs healthy, breath stacking should be done 2 to 4 times a day. Your respiratory therapist will set up a care plan that best suits your needs. In times of an infection, breath stacking and assisted cough may be done as often as every 10 minutes. It's best to do breath stacking before meals, but if you can't, Wait at least 30 minutes after eating. This will help reduce the risk of nausea and possible vomiting. You can even do your own or assist with your breath stacking and assisted cough if you're able to squeeze the bag and apply your own thrust. Finally, the assisted cough or stomach thrust may be used at any time to help move mucus. Your respiratory therapist can advise you if routine stomach thrusts should be used.
Do not do breath stacking. If you feel lightheaded, feel any chest discomfort, have an upset stomach, or are experiencing low blood pressure. If you think the breath stacking and assisted cough techniques are something you could benefit from, connect with your healthcare team to discuss lung volume testing and how to get the tools and assistance you'll need to get started.